Megan, I want to start with you. You work for Reaktor, and Reaktor wants everybody to understand artificial intelligence better. So let's start by watching a short video clip about that.
Artificial intelligence is like electricity. It will shape our world in ways we cannot imagine. Its masters will control how we live. AI is power. In Finland, we believe it belongs to everyone. With the help of the University of Helsinki, we built a free online course called Elements of AI to give anyone, anywhere, the tools needed to understand AI. After its launch in 2018, over 500,000 people have signed up for the course globally, including over 2% of the entire population of Finland. Most importantly, Elements of AI has cut across gender, age, and socioeconomic lines. More than 40% of sign-ups have come from women, while 25% of all users have been over the age of 45.
Tämä tekoäly, niin se ei ole mikään tulevaisuuden hirviö, vaan se on ihan arkipäiväinen asia ja se on ihan hauska asia. Kyllä mä suosittelisin tätä kurssia kaikille, jotka haluaa niin kuin pysyä ajan tasalla, et edes katsoisi, mitä se on, iästä riippumatta.
Elements of AI is more than just an online course. The OECD has cited our innovation as one of the reasons Finland will succeed in the 21st century. And Google's CEO wishes that our movement was a template other countries can use. We are expanding our success globally, working with governments and universities to ensure our content remains free to all students everywhere.
How successful was this program?
I think it was something that was, kind of took off in a way that we really couldn't have imagined. But I think a lot of it has to do with going back to the table at the very beginning, thinking about this from the student's perspective. So one of the important things that we did was to gather focus groups of people from different demographics. We wanted to target this course to people that are typically left outside of technology. The kinds of people, and especially the ones in our focus groups who thought, robots are going to take my job, or, AI is something that doesn't feel like it's for me, it's too confusing, I don't know what is information or misinformation, and then really try to deliver something for them. So super friendly graphics and conversational copywriting, breaking down an intimidating subject to people's level where they can start to feel comfortable with it is really what the goal was. And I think for us to this day, the thing that we're most proud of is that over 40% of our course takers are women, which is over double the average of every other computer science course online. So it really demonstrates that these things are, they're not just for a few elite coders. People really can start to grasp and understand them, and it does make an impact on their lives and on society.
So would it now be too bold of me to say that we're kind of the nation that totally most understands artificial intelligence?
That could be possible. Yes, I think now we've educated at least over 3% of the population. But I mentioned yesterday as well that we actually got on the phone and physically called every single high school in Finland, and now have elements of AI as part of the curriculum as well. So it just goes to show that in Finland, people are very open to learning about new things, and it's been a really big success for us.
Okay, well, that's really good, and I think it's really encouraging that the kids are into it, but what about as adults? I'm looking at these three gentlemen who all work for the Helsinki University Hospital. Visa, could you please tell us how much does the hospital use artificial intelligence?
Artificial intelligence more and more every day, and I think we have the basics in place in a way, because we went digital already in late 90s, and so we are biggest hospital in Europe together with the Berlin Charité Hospital, and that means that we have a lot of raw data, and now all that raw data is in a safe cloud-based data lake. So it's more and more usable, and now we start to have the most important thing, the talented people working with AI. We have these kind of very talented young clinicians like Rahul, who not only understand neurosurgery but also machine learning and artificial intelligence, and we have data scientists like Miika Leminen, who also starts to understand medicine. So I think we have the building blocks, and now we work.
Okay, well, Rahul, where in a hospital can you use artificial intelligence and machine learning?
Well, that's a good question. I mean, you can use it basically everywhere. But of course, data-rich fields such as intensive care, imaging, and pathology are the most areas that have gotten the most attention. We have several interesting projects, mainly in these fields. For example, regarding imaging, we have now developed this kind of online platform where expert physicians can, do the training of these new algorithms with the goal to create a model to help physicians identify, for example, brain bleeds in the emergency department. So now really, there are a lot of areas where it can be used, and we are getting better and better at it all the time.
Okay, well, but diagnosing brain bleeds, all the brains are different. So can you actually make a model that kind of represents all brains?
Yeah, all the brains are different, but the bleeds are basically the same. They look the same, the bleeds still. So, it's not that difficult for the algorithm to identify it. And I mean, the algorithm doesn't have to be perfect in the beginning. It's enough that if you take 10 acute head CTs of 10 patients with acute headache, the radiologists don't have time to look at them all at the same time. And among these 10, there might be a few that has a life-threatening disease. So if you have an algorithm that can, from these 10 images, screen 4 and tell the radiologist, hey, look at these 4 before you look at those 6, then I mean it's a huge help for the clinician, and it can possibly save lives as well.
And this is something which is scalable, so that basically if there is an algorithm and there is a good doctor somewhere, this doctor can go to a lot of images from different hospitals. And in a sparsely populated country like Finland, it's a very useful tool.
And a head CT scan, I mean, it looks the same in Finland, it looks the same in the US, it looks the same in India. So, it's really, really scalable at the global level.
So Megan's mission is to make us other people understand AI, but then you understand AI, but then you work in the hospital. So have you had language barriers? Lisa says you're learning, but how was it in the beginning?
Well, definitely that's something that we have to put some extra attention to. And I think both parts, I mean, clinical expertise is really important, but also we need some clinicians who are getting better and better understanding capabilities of these kind of machine learning models, but they can do what they cannot do. And on the other hand, the technical guys, usually some of them already have like some medical background, which is really important, but those who don't have, then they have to try to understand the clinical process, the diagnosis processes and other processes. And this is of course long way, but I think we are in good position now when we have these kind of people both in my unit, in IT department, and on the other hand, the clinicians who are working the projects. It's collaboration.
So what do you think is the response when you try to introduce more AI or machine learning into hospitals, into medical professionals' work?
I think there is a lot of enthusiasm of piloting the AI in for different problems, and maybe the first task these guys always have to do is that really consider, do we need something complicated or complex like AI or machine learning in here, or can we solve this issue in some simpler way, because most likely there is a simpler way. So you always should go with the simplest possible answer.
Do a lot of people ask you about, like you said, some people are worried like robots are going to take their jobs. Do you think robots are going to be taking their jobs?
I think, AI and any type of automation processes are there to optimize. And that will mean that certain tasks are actually going to be eliminated. But a lot of the studies that are coming out of places like MIT will look at people's individual jobs and say that it might not even be that the entire job is eliminated, but that specific tasks are eliminated, leaving more time to do other things. And these kind of processes, they do take time to implement, and there will be a change, but this is why we're actually trying to step up and do something about it. A lot of the jobs of the future will require these kinds of digital skills and this kind of thinking. So, finding a way to have people feel that they can approach these subjects without feeling, extra intimidated is really important to us, is trying to address that gap. And, if you think about how this actually works in practice in the field, this idea of thinking like a data scientist is going to become more and more important as we go forward, because you do need people that have the kind of expertise in whatever they're doing, even on the ground in manufacturing or whatever, in order to help train these models and help the data scientists solve these problems. So we actually, with elements of AI now, we've recognized this on a larger scale, specifically for people in work. And so we've developed a sequel course that's going to be launching by next month. I'm not going to be the one that gives the exact deadline, called Building AI, which is going to help people start to understand how to think like a data scientist and even start to code and train very basic different types of machine learning models. And it's not, again, that course is still not going to be something that's going to make you a machine learning scientist at the end of it, but it's meant to address exactly these kinds of problems where people just want to get a grasp on what they're doing so that they can start to make decisions for themselves in the new jobs landscape.
Do you think, as a doctor, are you thinking more like a data scientist, like Megan said?
Yeah, I think so. I mean, with this AI revolution, then every physician, I think, should know, something about machine learning and AI. And most of the physicians, I think, sees it as a possibility to evolve to the next level kind of physician. We don't see AI as a threat replacing us, but more of like a special tool that will help us be, even better physicians.
Because today in the healthcare, the doctors and physicians and nurses, they're overwhelmed with the data. There's so much data coming on them. You can tell something about this intensive care study you have.
Yeah, for example, that's a good example. We are developing this algorithm for patients treated in intensive care unit with severe brain injuries. And when you have a severe brain injury and you're in the ICU intensive care unit, you're unconscious, and it's really, really hard for us to know how the brain really is doing. We have a lot of indirect markers telling us that, okay, the intracranial pressure is now high, it's a bad thing, and the blood pressure is high, it's a good or bad thing. But we get millions and millions of data points every day, and for a physician or a nurse or anybody to grasp all that information and see complex relationships between the variables, it's impossible. So that's why we now developed this algorithm that combines all the data and gives us a number at how well is this patient doing. And that number is not going to replace us. It's going to help us make better decisions in the future.
That's really amazing. Is this something you're only doing in Helsinki, or are you trying to spread that out all over the world?
It's actually a collaboration study with 4 university hospitals in Finland. So it's a really interesting project.
Wow. So do you feel like you are the in-house sort of ambassador to teach everyone to think like a data scientist, like Megan was saying?
I think this elements of AI is a good example that every medical student should have at least that level of understanding, because the ideas are growing in the field. And usually, speaking as an engineer, then purely engineer designed idea is quite often quite naive. And then the best ideas come from the physicians when they really deeply understand the tasks and what would be the most effective way of designing this kind of model that would help in a clinical process. So again, it's the collaboration. So
you have to collaborate public-private combinations. How is it working with businesses?
There are a lot of, let's say, things to learn for us, but we have some very good examples on this kind of collaboration. One of them actually was with Reaktor, who was one of the first partners for us in doing this kind of advanced analytics and AI. And of course, we have to understand, as a public organization, there are more strict rules how to do this kind of collaboration. But I would say that Finnish startups and also some big companies, they are quite. We have this kind of what we call Clever Health Network, where we are together with small, medium-sized, and big companies, and then WHOOS. And in there, we discuss and try to find new ideas for this kind of development, and really as a co-ventures, not like we are buying some service for somebody, but together with the companies, we are developing new things in advanced analytics. And in there, we have actually 4 or 5 quite interesting projects ongoing at the moment. So.
My next question was going to be whether, in a positive way, what is the best vision for after 5 years? What does the world look like? But we have a question from our audience, which is much more dystopic. So I'm going to ask that. Are you scared that AI will become smarter than humans and take over decision-making? The worst scenario of singularity. Let's start with Megan.
You can say that it depends on the human. But
true. A lot of my exes are ready. Yeah.
We were actually discussing this.
Now, this is
outside,
something that I just read an interesting book where there were 25 of these kind of top-level long-term AI best gurus in the world, and each one of them tried to answer this question, and only thing I learned from that book that the answer is all over the place. There are Kurzweil who says it will, this singularity, this superhuman brain, artificial brain will come in 20 years, and then there are very top scientists who say that it will never come, and I think the only thing we can know at this point is that we don't know, but there is certainly a possibility.
I think the most important thing now is for people to understand how the technology works and how it can evolve. When you think about the theories around AI, a lot of them started to gain traction in the 1950s. And the scientists in those areas became really, really, really excited and articulated the kinds of things that we're only seeing now today in our world. But what happened was we didn't have the kind of compute power and the amount of data needed to actually make those things a reality. Something like this, if it is possible in the way it's described, is a long way off. And it's not just because of the technology, it's because of the way that we adopt it as humans. Something like that would require massive amounts of open data to be possible. You need to have this data open and freely moving between these machines in order for them to make these kinds of decisions. So what we have now is the opportunity to take a step back and say, what didn't we do when we knew about these things in the 50s that we're having issues with now? Algorithmic bias and how it has effects on societies. We saw what happened in the last election in the States, for instance. So what can we do now armed with this information to try to prepare ourselves for a future like that? And that's really where getting as many people as possible to understand is the fundamental goal.
And
I just thought that what would you say, because you work with the human brain and artificial brain, so what's your...
Well, I mean, again, I don't see I mean, if you take that example that people get general AI sometime, if you get ethics and morale built into it, I don't see, it's probably a good thing. But I feel, seeing the brain, I have been working with the brain for some time now. I feel it's a long shot.
That's really reassuring.
In a field of clinical medical work, I guess one solution doesn't fit all, and for us it's like evaluation of risks. And so there are definitely some tasks that can be automatized, but definitely there will be some tasks that cannot be, if the risk is, for example, really high, if the prediction is wrong, and then it's like most likely really long time, like human expertise work that these guys are doing every day. But then some combination of different tools and some tasks can help physicians to save some time and make better decisions. So it's like mixture of different solutions.
One last question. What do you think is the biggest change that is going to happen in healthcare because of AI, say in the span of like a reasonable future, 5 to 10 years?
We can not only take one individual, but we can take the whole population and basically treat that population in a way we cannot today, I would say.
Wow, that sounds like sci-fi. Okay, great. Thank you so much for a really interesting conversation.